this video we are going to talk about the problems in cardiovascular system. The commonest problem seen in this system is the high blood pressure, what we call as hypertension, then ischemic heart disease where the blood supply to the heart itself is compromised, then various types of strokes, where the blood supply to the brain, to the various part of the brain is compromised. So the cardiovascular diseases or the range of these problems are rising over last few decades. We are seeing two parts in this. The incidence of all these problems is rising, and at the same time the age at which we were seeing this problem, this age is getting lower and lower. We are seeing many young patients nowadays who are facing these various cardiovascular problems. Why these cardiovascular problems are suddenly on the rise? Again, the key villain in this is the wrong lifestyle we have chosen in last few decades is the center of the this why. First of all, the sedentary lifestyle or lack of exercise in the daily routine is a very hazardous thing we are doing. The second thing which I am doing is the diet which is very high in simple carbohydrates. This type of diet, which is low in antioxidant, low in vitamins, low in minerals, makes my body acidic and it puts my body into the sympathetic overtone, which is very bad for my heart or cardiovascular system. Third is the amount of sodium the humans were consuming in the past days and in the present day. The sodium potassium ratio has been totally inverted. Previously we used to consume 5 times potassium as compared to sodium. Today this ratio has been exactly reversed. We are consuming too much of sodium. Salt is the major culprit for this cardiovascular problem. Similarly, same thing can be said about the omega-6, omega-3 fatty acid. Today's diet is very poor in omega-3 fatty acid. The omega-6, omega-3 ratio is not maintained. We are consuming too much of inflammatory omega-6 fatty acid. At the same time, the amount of trans fat that I am consuming is also on the rise, and these two deviations has put many disorders in my cell wall, in my blood vessel wall, where the stiffness has increased, elasticity of these various organs has gone down. So these two factors also play a very major role in the cardiovascular issues. Stress in the modern day life is also one important culprit for the cardiovascular issues. As we all know, stress promotes certain chemical changes or hormonal changes in the body which are inducive of high blood pressure or hypertension. And last but not the least is the air pollution or smoking. We all are, most of the cityites are living in highly polluted air. This carbon monoxide is directly hazardous to the body. It damages my body at various places, and this is also one important cause for rising incidence of cardiovascular problem. Again, in the conventional treatment, we are not dealing with these basic causes. Suppose there is a rise in cholesterol, I am suppressing the cholesterol. In fact, cholesterol, as we all know, is very important building material of my cell wall. It is very important constituent of my various hormones, my sex hormone, my steroids, all are made up of cholesterol. So without respecting this body design, I give the medicines to the people for suppressing the cholesterol levels. Same thing can be said about various alpha blocker, beta blocker and vasodilators, because vasodilatation, vasoconstriction has been a body's design to allow body to shift the blood flow from the less required area to the more required area. I will give you one example. When I am sitting here, my muscles are getting just hardly 15 to 70% of my blood supply. When I will start running, this percentage will go up to 70%. So how body does this? Body does this by constricting different vessels, dilating different vessels. When I am on some blood pressure medicine which abnormally dilates the blood vessels, this control of the body is lost. So you can understand, this is not as simple as we think. Each and every chemical, each and every hormone has been interrelated at least at 100 places in the body. It's like a software written by a particular programmer. The reference is used at, that code is used at 50 places, 100 places. We cannot delete just one line randomly. We are doing that very repeatedly in this conventional today's medicine or today's treatment. The root cause of all this, as we have seen, is the wrong lifestyle. So for dealing with the cardiovascular problem, we should correct our lifestyle. For correction in the lifestyle, simple again, we should have a pretty decent time slot for the exercise. You should exercise at least for 30 to 45 minutes every day. Your diet should be rich in complex carbohydrate, rich in good fats, it should be rich in good proteins, plus it should be rich in various vitamins and antioxidants. Third, your body should not be acidic, because acidic body is a sympathetic body, is a stressful body. You should go to the alkaline zone as early as possible by drinking plenty of alkaline water, by having alkaline food, which as we have covered in part 2. All this alkalizing food is the food which is full of antioxidants. So then omega-3, omega-6 fatty acid, I ask the people to stop consuming refined oils, because they contain 0% omega-3 fatty acid. You should go for cold pressed oils as much as possible. Then fourth is the sodium potassium inversion. Cut down your salt intake as much as possible. You can go even on salt free diet. The sodium, what you think, which is required to the body, doesn't come to you from your salt. It comes to you from your fruits and vegetables you are eating. God knows how much potassium is required to you, how much sodium is required to you, and that is sent to you through your fruits and vegetables. So cut down the salt consumption as much as possible. At the same time, you should have very high potassium intake. This potassium sodium rebalancing will be very friendly to your heart, to your cardiovascular system. Obviously, smoking, as everybody knows, is very bad for the health. Particularly if you have cardiovascular problem, just quit the smoking as early as possible. Living in polluted area is equivalent to smoking. So you should find out the solution for this. Spend more time in good air, in cleaner atmosphere. Relief of stress. You should practice daily meditation. You should know the technique how to handle the stress, and you should have a good quality sleep. These things will definitely help you to handle the stress in better way, and this will ultimately cause reversal of various cardiovascular problems.